Singer Chris Brown was booked again for assault with a deadly weapon.
Doctor, thoughts on what's going on with Chris Brown?
Well, goodness. I mean, his rehab facility, the one that he actually finished treatment, because remember in 2013, he got thrown out of a rehab facility because he threw a rock out of a window after having a bad family session with his mom, who wanted him to stay in treatment longer. He finally finished a 90-day treatment that was court-ordered early 2014, but that treatment said, listen, he has some very severe mental health issues. He's got bipolar disorder. He has post-traumatic stress disorder. He has drug issues, because that is a thing that sometimes people with bipolar do to try to regulate their emotions. We need to keep track of all of these three things. Even though he's not with us anymore in a residential treatment program, he needs intensive outpatient treatment. Okay. And he claims that he learned some things from the treatment program, but I don't see any of that learning, because he still has all of these altercations.
Let's kind of flip the script a little bit and talk about the woman who says he did all of this.
She messaged the friend who brought her to the party who had left.
Said, oh, is he going down? Meaning it's almost like
premeditated.
I'm getting him in trouble. Do we hold her to be credible?
This is part of the problem. I think a lot of people are questioning her motives, her credibility, if she's just trying to jump on this and have her 15 minutes of fame. And that's going to hurt the case that they may or may not have in court right now. But I think she's jumping on a train where there has been multiple stops, right? These multiple stops of alleged assaults and altercations. And so at the same time, he may very well get right back into a program where he has to be required to go to treatment. And honestly, I feel like that would be a good outcome, because he's clearly not following up. It appears that he's still on drugs, and he's not taking any responsibility. So how is he ever going to curb any of these behaviors? It appears he has no motivation. So maybe something good can come out of this.
What does the DA do with this?
If this case goes anywhere, they might put him back into treatment. They may actually ask him to go back on probation and get drug testing. I think that that is the most likely scenario to happen, especially if they decide that the woman is credible enough to present. So the DA is going to make that decision.